small eyes and also the thin upper lip. Now that only looks at the physical exam findings, of course. So there's other surveys that have been developed. This is just one of them, which is an FASD, which is the Fetal Alcohol Spectrum Disorder Behavioral Trait Survey Screening Tool. It was a 53-item screening tool for children, teens, and adults, and kind of going back to the alcohol-related neurodevelopmental disorder that we talked about. It's for kids that have that without the facial features for a full diagnosis of FAS, but they have some of the other features. So its intended use is for educators, frontline social and medical service providers who have had long-term close contact with the individual. So again, I unfortunately have not personally used this, but just so that you know that they are out there. I did find a study that was the Washington State Foster Care Passport Program. So apparently Washington State Foster Care Program had a very high prevalence of fetal alcohol syndrome. So their prevalence in their foster system was 10 to 15 per 1,000, whereas general population is about a 1 per 1,000. So they did a study with about 600 kids, and they screened for 3 things. They looked at the phenotype, which is those facial expression, those facial exam findings, physical exam findings, from a photograph, from a picture. They also looked at evidence of brain damage, and by brain damage they were looking at microcephaly, which is the small head size, seizures of unknown origin, and then an abnormal brain image. So maybe they had an MRI or something of that nature. And also with a prenatal alcohol exposure from a health summary that they had in their medical records. They also screened for other syndromes identifiable from a facial photograph, because one of the other things is that there's not